talk a little bit about rosacea.
Rosacea, yes.
I know when I first became an esthetician, it was a mystery condition.
Yeah.
And it seemed like no matter what we did to try to make it better, we made it worse.
I know, and it was 10 years ago when I would say 90% of the companies didn't have a product for it.
Looks like you're getting some great results.
Yeah, I mean, it's just been a whirlwind though, and you have to ask yourself, why is it in the last 10 years rosacea has become such a dominant force? It's affecting, I think it's like 40, 50 million people now. It's a really remarkable number.
And it seems like it's starting earlier and earlier. Younger people are coming in with it.
It's interesting you say that. I just saw the girl of one of my employees yesterday, and she had those rosy cheeks, and we used to think, oh, those rosy cheeks are so cute and a baby, and now I'm like, I think she probably is having a reaction to her food, and so I think we're starting to really better appreciate that the inside of the body plays a major role in the inflammation. This gentleman right here had, I think beer as a heavy part of his diet. And as a result of that, he became inflamed. So we can talk about what causes rosacea if you want.
Sure, I'd love to know what causes it.
And we've been saying so many things are candida, and candida is one of the causes, but it is not the exclusive cause. In fact, it might even be a minority in the causes of rosacea. So first and foremost, rosacea is inflammation at the skin level. And I think that's what got all of us physicians confused, because we're like, what's happening at the skin level? And the reality is what you're seeing is another toxin reaction. Again, toxin reactions can be like acne, where they're purging them out of your follicles. They can be like eczema, where you're peeling skin, or they can be like rosacea, where he has peeling skin. But most rosacea cases, they're just red, right? The skin is processing as best as it can.
It looks very rashy to me. That's always what I thought at first.
Yeah. And it has different appearances. It can, of course, get very severe. It can be very mild. It can be on different parts of the face. So what's been fun for me as a physician is that by, again, sitting back and collecting the data from all of the people around the world that use osmosis and seeing the different pictures, I began to see a very distinct pattern of presentation. So, for example, we know that if rosacea starts on the tip of the nose, that reflects a inflammation at the back of the throat. And that back of the throat inflammation, the number one cause is hard alcohol. As you move down your digestive tract, you move down the side of your nose. So we find that rosacea that's affecting the side of the nose, and you'll see a lot of people that have capillaries on their nose, that's caused by acid reflux, and it's completely associated with the lower esophageal sphincter. So again, that gets eroded by the acid. Toxins from your diet get into that, and you have inflammation at the skin level.
I have so many clients that are going to get laser treatments here.
Yeah.
And it's crazy because it goes away for a little bit. Again, a temporary fix.
Comes back. And why does it come back? It comes back because the toxins are still hitting their system. We work our way down. Stomach is right here. Small intestine right here. Large intestine goes all the way around the forehead. So we can actually track rosacea based on where it's happening. And what it tells us in many cases is what the cause is. Like I said, typically it's hard alcohol, too much hard alcohol.
We call that a gin blossom.
Gin blossom, yes, it makes sense because it is definitely caused by gin blossoms. Then you have acid reflux. You have H. pylori in the stomach, can be right around the nasal flare. And then we usually have candida. It starts to kick in right around here. And then candida can kick in the large intestine. Great way to tie this together is I was just speaking in Australia, and a woman's like, well, I didn't have candida. I had SIBO, which is small intestine bacterial overgrowth. And she was getting breakouts right here in the small intestine zone. So over and over again, I get confirmation that these parts of the face are reflecting what's going on. And so yes, small and large bowel, that's where candida may be at play. But you'll see, you probably, if you're someone with rosacea, it wouldn't surprise me if you have irritable bowel, and you never connected the two. We talk about foods. That was always the big thing in the beginning. Well, it's definitely in the skin, but spicy food makes it worse. Well, how does that work?
Don't drink red wine. You said
Yeah, red wine, exactly. So all these things are actually creating inflammation in the digestive tract. So what osmosis does uniquely is we take a holistic approach. We address the imbalances energetically in the digestive tract. In his case, we actually also address the inflammatory pathways by giving the digestive tract that trioxylane oxygen tool that helps it repair damaged tissue. And you can see, in 35 days, we made a dramatic change. The results come very quickly. You can't overstimulate the skin. You know, when we're talking about topical agents, you want to use anti-inflammatories in the beginning because trying to make someone younger while they have this condition will be too much.
Yeah, there's a lot going on the face, and that is a really rapid result. Impressive.
Yeah. Like everyone else, rosacea clients want anti-aging treatments too. So we set them up on a protocol where they start off by really healing the condition through their own skin strategies and then working our way up to, our age reversal strategies. But all along addressing the digestive tract. And just everyone remember, if you've got capillaries on the sides of your nose and you're thinking, I don't have acid reflux, chances are you do, because about a third of people don't know they have acid reflux. And in another video, we actually talk about the strategies for helping that condition as well.
That's great information, because I know a lot of people are suffering with rosacea, and I love how you do. You go in and you treat it at the source.